progress, surveying history's #1 failure. Of all the fields which deal with the elimination of disease, medical science enjoys a near monopoly. It has gained the widest acceptance and holds a foremost position throughout the world. Not only is it one of the oldest of all practices, it has also had the bulk of funding for research. Accordingly, it should have made great progress, at least far more than its minuscule rivals. That medical science has been highly successful is the opinion of most people. It has supposedly lowered man's suffering from diseases, found remedies for many chronic diseases, and found means of preventing many others. Likewise, the claim is made that medicine is responsible for the increased lifespan in recent years. Generally speaking, medical progress is, in the public mind, an established fact. The real picture is a far departure from that which has won public acceptance. It fails to show that medicine has indeed raised the standard of public health. It questions all medical methods and the value of thousands of years of medical practice. Further, it reveals that medical practice has been accepted largely upon blind faith, that there is no real evidence of its viability. There is available a large array of facts which justify this reluctance to give credit to medicine. Perhaps the outstanding examples of its failures are found right here in the United States. It is this nation which has the most extensive medical service, the most physicians, and the most hospitals. If medicine is capable of producing good results anywhere, it should have done so here, but a few careful observations show that it has failed in its purpose. The most frequently mentioned victory of medical practice has resulted from its fight against the so-called infectious diseases. Statistics show quite clearly that we have fewer of these diseases than formerly, but for this, medicine can be given no credit. Medical efforts to prevent these diseases have taken the form of serum and vaccine injections. However, a study of disease rates fails to indicate that the rate of so-called infectious disease is lowered when these injections are given. In fact, in some cases, the disease rate climbs as the use of serums and vaccines increases. There is obviously a distinct cause, existing apart from medical practice, that is responsible for the reduced disease rate. This may be in the form of improved dietary habits or some other change in the American way of living. Of one thing we may be sure, the so-called victory of medicine against these diseases has never had any real existence. The prevalence of degenerative disease in America today and its rate of increase in the last 50 years is something that is not common knowledge. The public has not been given the real facts. There has been no victory against the most common degenerative diseases such as heart trouble, arthritis, rheumatism, hardening of the arteries, cancer, diabetes, etc. Although it is not generally admitted, these diseases are far more common today than ever before. In the last 50 years, insanity has increased 400%, epilepsy 300%, anemia 300%, diabetes 1800%, and cancer 308%. This steady increase is continuing year after year in spite of the most extensive medical service, which includes the work of 145,000 doctors, 280,000 nurses, and 60,000 pharmacists. Or perhaps it should be said that it is occurring because of this service, for the rate of increase has been in proportion to the increase in the employment of drugs, serums, and vaccines to prevent or suppress the acute disease. The physical examinations of 22 million men between the ages of 18 and 45 in World War II have likewise revealed the failure of medicine. Of these, 11 million, or fully 50%, were rejected for physical reasons. This was a much higher percentage of rejects than occurred in the draft of World War I. The percentage of nervous debility cases had doubled since 1917, and the amount of tooth decay had increased fourfold. Nearly 1/3 of all rejects suffered from a lack of mental health. It is noteworthy that it was the prime of American manhood which was examined by the Army. If the condition of the youth and middle-aged groups of America is so poor, that of the older groups must be indeed deplorable. The late World War, contrary to the popular opinion, did not demonstrate increased medical efficiency. Rather, it was just one more demonstration of the failures of medical practice. Dr. Paran, Surgeon General of the United States Public Health Service, studied 2,660,000 persons, representing every age group and economic level, a cross-section of our population, and made records of the health status of this group. Assuming that it was fairly representative of the American population, he concluded that on every day, 1 out of 20 people is too sick to attend school, go to work, or attend to customary duties. That on the average, every man, woman, and child in America suffers from 10 days incapacity each year. That the average youngster is bedridden with illness 7 days each year, the average oldster 35 days each year, that 6 million people are sick each day, and 42% of these suffer from hardening of the arteries, heart disease, rheumatism, and nervous diseases, that 500,000 people are blind, 65,000 are totally deaf, 75,000 more are deaf mutes, and 1 million are permanent cripples. These are the health statistics of a sick people, of a nation which suffers proportionately from far more disease than the lowest primitive races who have never seen a hospital or acquainted themselves with medical science. Dr. Perrin places a large part of the blame for the health problems of Americans on poor housing, hazards of occupation, and instability of the labor market. But these are only secondary causes. Medical practice must take the real blame. With almost unlimited resources at its disposal, it has failed to provide a high standard of public health. The high percentage of disease among children is seldom realized. The United States Board of Education has stated that 400,000 children in America suffer from organic disease. 1 million are afflicted with the various forms of tuberculosis. 10 million possess enlarged lymphatic glands. 1 million have spinal curvatures. 4 million suffer from malnutrition. 10 million have imperfect teeth, and 15 million present physical defects of one kind or another. When Dr. Alexander T. McNichol of New York examined 10,000 school children of that city, he found that 35% suffered from heart derangement. 15% had some nervous disorder. 60% had anemia. 27% had tuberculosis, and 20% suffered from spinal defects. He concluded that if all of the children so suffering had been removed from schools, 2/3 of the New York schools would have had to close. Statistics show that in Cleveland, Ohio, 981,000 children have recognizable physical defects. In Washington, D.C., fully 90% of the children, at the time they enter school, show similar defects. In Chicago, examinations of school children showed that 86,000 had defects of the teeth and palate. 10,000 suffered from anemia. 10,000 possessed enlarged lymphatic glands. 25,000 had impaired vision. 6,000 were afflicted with pulmonary disease. 4,000 had skin diseases, and 1,000 to 2,000 had nervous diseases. One would have to search a long time among primitive races to find even a single group with a health record such as this. We are a nation of weaklings and physiological cripples. Even the young children, who should present the best physical condition, suffer from one disease after another. The healthy child, free from all disease, is almost unknown. Medical authorities have proudly pointed to the recent increase in the span of human life. This is said to be an excellent example of medical progress. We live a good deal longer than our ancestors did. There is no doubt about that. But this increase in the length of life has had nothing to do with medicine. Rather, it occurred in spite of medicine. Today, the average human, aged 35 years, can expect to live only slightly longer than his grandfather, who, at the same age, could have expected to live. The life expectancy has increased hardly at all for the middle-aged person. The drop in the rate of infant mortality has been almost solely responsible for the increased lifespan. Formerly, infants were cared for in a manner that was in every way conducive to high mortality rates. Today their care is still bad, but it has improved much, especially in regard to diet. The increased use of fruit juices and vegetables for infants has perhaps done more than anything else to lower infant mortality and thus prolong the average lifespan. However, it was certainly not medicine which recommended the changed diet for infants. At first, medical science condemned fruits and vegetables as being dangerous to health. Then, when the use of these foods had become established, medical authorities dropped their objections, acknowledged that fruits and vegetables should be used in the infant's diet, and took credit for inaugurating the change. Associated with the continued degeneration of the American people is the increasing percentage of facial deformities. Studies of primitive races indicate that a lack of beauty, especially facial beauty, should be considered a disease which may always be prevented by building the health of the parents to a high level. This ensures the birth of infants with normal facial structure. Among civilized races, facial deformities are chiefly deformed dental arches, pinched nostrils, and defective jaw structure. Today, it is doubtful that over 5% of the American people have approached the normal high standard of beauty, which is characteristic of the healthy members of every race. Medical science has done virtually nothing to decrease the need for surgical operations. In fact, conditions which are claimed to require surgery are becoming more common than ever, and the use of surgery has increased many times since the beginning of this century. In fact, its increase has been in direct proportion with the increase of surgeons. Rare indeed is the person who has not had some sort of operation. Operations for the removal of the tonsils and appendix have increased at the most rapid rate, and the indications for the future hold no note of optimism. It is claimed the need for surgery will increase. Not only has medical science failed in its efforts to prevent disease, it has been equally unsuccessful in its attempt to eliminate disease once it comes to exist. Statistics show that more patients recover from acute ailments with no medical care than with the most expensive medical care. This indicates that medical care is a bane, not a boon. The death rate during the influenza epidemic of World War I was very high for those patients who underwent medical treatment, but it was practically nil for those in whom the affection ran its course. The death rate in cases of appendicitis is several times as high when there is an immediate operation as when the operation is forgone. Moreover, later complications upon those who have had this depurating organ removed indicates it extremely unwise to remove the appendix. The absence of treatment provides better results than medical treatment, which is usually hurtful. There is no evidence to indicate that there is less disease today than there was 1,000 years ago. There is no evidence to indicate that modern medical methods of treating most of the diseases are any more effective than those of the sorcerers of the Dark Ages or the witch doctors of primitive tribes. There is no evidence to indicate that we live longer than did the ancient Greeks or as long as many primitive races of today. All studies show that we in America, with all our physicians and great hospitals, suffer from far more disease than do the races in the most backward regions of the earth. We are retrogressing, not progressing. Medical progress is only a figment of the imagination. In the final analysis, everything must be judged by the results it provides. If it works and produces the desired results, it is of value, but if it does not do this, it need be of little concern to society. This may be applied to medicine. It has not produced the desired results. Its record is one of continuous failure. The object in this case should be to turn to something constructive. By doing so, we have nothing to lose except our sicknesses. We have good health to gain. This does not mean that we must reject everything that has come from medical practice. But it does mean that we must reject the great preponderance of its practices. Drugs may be discarded entirely. At least 99% of all surgical work may be dispensed with as harmful. The remainder, employed chiefly in cases of wounds and accidents, will perhaps be our only relic of the age of medicine. In the absence of seeking out physicians, our populace, if they should unwisely bring illness upon themselves, will resort to natural remedies, as do animals. Primarily, this means a resort to fasting when feeling out of sorts. Perhaps a method of body care that does not cause disease will come into general vogue.